Just about to go see a patient real quick, hospice patient that we recently admitted. About to drop off some supplies and talk about the pain and the struggle of scaling and how important it is to make sure it's done well. So let's go. All right. Woo. What do we got here? So this is a hospice patient that we have. These are the supplies that are given to us to take care of the patient. Tailored towards the need of the patient. So you're looking at the supplies, the types of supply. This is underpads. We got gloves. We got briefs, extra small. This guy's super sweet and really tiny. Wipes. And that's the start. Just admitted, and the DME is getting delivered right now, hospital bed and such, and we on the way. We on the way. So there's a book that I'd recommend if you are a business owner and operator, if you're just starting or you're going from, net revenue of 3 mil to 10 mil, whatever it may be, or 20 mil. There's two books I'd recommend. 10X is better than 2X, and then The Lazy CEO. I don't remember the author, but I'm sure I'll put like a little image up there for you to see. But in the book The Lazy CEO, the title kind of captivated me. I was like, this is kind of interesting, but it's not really about being lazy. It's about making sure that as you're growing, there's seasons of a CEO where they may look to be lazy, but they're not. They're just being efficient. And so as an organization, right now we're in a season of scaling. And the biggest thing that I don't want to do is I don't want to scale and the care diminishes. Because that's not why we started this company. That's not why my mom started it. It's to take care of patients. And so what I've tried to do, I'm a clinician, so I love bedside. That's just who I am, right? What I've tried to do is understand, how do I merge both worlds, right? How do I merge great care, but also efficiency and being effective from a corporate scale, like a massive scale? How do you do that? And so in The Lazy CEO, there's sections where it talks about the CEO has to have several hats. And within the hats, I'm not going to give you all the information, it's a great book, but within the hats, there's times where the CEO has to do certain things and put on certain hats. And within those certain hats, he has to, when, say for instance, you're building a skyscraper, you have to go in and put the hard hat on, and you have to go in and do the grunt work that needs to be done. It just has to be done. But the hat cannot be worn forever, because the CEO has a job, and only he can do that job. And when you're trying to scale or grow, I'm on that journey, and I've got mentors and people around me who have already done it, who are leading me and guiding me and giving me the wisdom that I need to be successful. You have to roll up your sleeves. It's this part of the work. You have to put on the hard hats. You have to do more than what people do. You have to stay late. You have to, this is what it is. Like, you have to put in that work, because the outcome, because there's a part of the business where, you don't have enough funds to bring on more people. So you have to do the extra work to get to that next level. That's just what it is. Like, it's what they call growing pains, right? And so right now, that's kind of where I'm at. But man, I truly do love taking care of my team. I do love taking care of patients. I enjoy going to see patients. So for me, this is a joy. I love solving problems. I love figuring out solutions. So I'm in the transition of where, I told you guys before that my wife has to be transitioned out. So we kind of worked together side by side for a while. And now we're getting at the point where, okay, she'll be removed, and I need to make sure, because for so long everyone was kind of like relying on her and me to do everything, but it's not feasible, because when there's more things to do in an organization, you have to be able to delegate and train up new people. So right now there's a part where I know that there's going to be some service failures, but I know my heart is to make sure that if there is a service failure, I'll bounce on it right away and correct it. So hence, right now, that's what I'm doing. Making sure that this patient gets these supplies because it was missed, right, in those small areas. Just, just this morning, the patient was admitted last night, right, but, just a small thing to make sure that the patient gets what they need. And that's what it's all about, right? And so whenever, I think a lot of times when you see big organizations and you see these service failures, it's very easy to judge from the outside looking in, but there's a lot that goes into running an organization, especially when it comes to hospice or home health. And that's kind of where I'm at. If you are doing this and you are starting from scratch, you're going to have to wear several hats. If you're trying to scale or grow, you're going to have to wear several hats. You cannot avoid it. That's just what it is. And but it is a season, because you will not wear that hat forever. You'll give that hat to someone else and empower them to do a great job with the skill sets and the God-given talents that person has, and they'll do it way better than you can as the CEO, and that's how it's supposed to be. So but yeah, that's where we're at right now. I'm on my way, and